Hi, this is Dr. Anjana Bhana coming to you from my practice, and today we are going to do my favorite procedure, PRF, Platelet Rich Fibrin, on my beautiful patient Michelle, who's so gracefully volunteered to have the procedure done today. I love this procedure. It's a step up from PRP, and I am going to go through all the steps with you. So when you get back to your practices, Michelle has been numbed already for at least 20 minutes. Why it's important to numb the patient before you even do the blood draw is that PRF is a really quick procedure. It clots within 12 minutes. So different from PRP, where you have 4 hours to use the spun blood, and it spins for 20 minutes, whereas this spins for 5. So Michelle has already had the numbing cream on, and after this I am just going to take it off and disinfect, draw the blood. Okay. So what I'm doing now is I put on hypochlorous spray, it's a disinfectant, and Michelle has a tendency to go a bit red, so it's an anti-inflammatory as well. And now I'm just disinfecting with my usual alcohol chlorhexidine mix. Okay, now I'm just cleaning the site. Okay, 5 minutes later, and the PRF is done, so I have to be super duper careful taking it out. You can see it's really nicely separated, but it's still high risk. If I shift it a bit, it'll just, mix back in the blood. So we're slowly going to take it back to the tray. Okay, so that's the PRF. I'm putting a smaller needle on because I'm going to do some biological lips and needling. Okay, Michelle. So I'm going to inject your lips first. Actually, I'll do very little on the lip. You okay? Michelle just has topical anesthetic on the lip, so just to go slowly into the lip. Not to over inject. So before I go onto the under eye, I change it to a thinner needle. It's just good when you're moving around different areas of the face. Change your needles. It makes it more comfortable for the patient. It's better, decrease cross-contamination. So this is one of the areas that really bugs Michelle, but we're prepping it for filler. So not ready for filler yet because the skin's so thin. So we don't want any residual puffiness from filler. So I'm strengthening the under eye area using PRF. And you can even go down on the bone. It's moving slowly because this is a thin needle. Okay, so we're going to start microneedling the PRF in. It's still nice and liquidy. So I always start with the forehead first because it's the most sensitive area. The rest gets numb really nicely, so the patient can relax for the rest of the procedure. And you saw that I was using a really thin needle for the eye area and injecting slowly, also injecting the lips slowly. You have to remember that we're dealing with people and they've got delicate tissue. So slow, easy injections, even though this is a safe procedure, reduces post-operative complications. Okay, Michelle, I've turned to the side a little bit. And why I like attaching a needle instead of just squirting the PRF. There's no wastage. It controls the flow of PRF and it doesn't run all over the place. So it's a really nice tip that you can take away. And what I'm using now is the Dermapen 4. So at this speed, 1,920 little punctures per minute. So we're creating all these micro channels into the skin. And creating like a controlled injury along with the PRF, so you get like amazing collagen production. Okay, and then often, if you turn to the side, Michelle, so this is the earlobe, and you can put filler in the earlobe. So people often forget their earlobes, but it's also aging. You can put filler in, so it plumps it up. It's really nice if you've got, you wear these heavy earrings, so it gives the ear some nice support. You can also needle that in. What happens afterwards, there's like this layer, it's platelet pore plasma. It provides some relief. There's still some white blood cells in there. So, okay, so this is a super delicate lip mask that we're going to put on, and then we're also going to put on the hydrogel mask. I like doing this post PRF biological lips. So putting a super green mask on for you, Misha. It's just to calm the skin and rejuvenate it. I'm also not, you can put this over the eyelids, but I'm not going to because Michelle has some beautiful lashes on. So while I'm putting all the different masks on, and I'll show you some little trick if you don't have a mask as well, is just to show you all the different things you can do. So besides a hydrogel mask, after a procedure like this, you can use a sheet mask or a mask like I used on the lips. Something we really love is phytocorrective gel from SkinCeuticals. And I also like doing this. So I take the GF spray with hypochlorous and really spray a whole lot of it because it's anti-inflammatory and it's a disinfectant. And you do this over the patient's neck or face. You can actually do it over their face as really nice and calming for that area. Dirt treatment. So if you don't have a mask at hand, that's one of the things you can do. And then we wait for 7 minutes and we pull it off. So this is the jet plasma. It is alternating current. So Michelle has taken off all her metal goodies because that's actually the thing that earths the current. So it's PRF is a really versatile procedure, so you can pair it with pretty much anything afterwards. LED light, and one of Michelle's favorite treatments is, it's called the jet plasma lift. So this is a massaging head. It comes with another head where we can even do like a so-called non-surgical blepharoplasty to tighten and lift the eye area. But this creates plasma, which is basically the fourth state of matter. It's a gas, and like if you think about lightning, it creates little thingies of lightning at the end of this that creates lift. So I'm putting on loads of phytocorrective mask. Hey Michelle, you okay? Because it's very, very cold and soothing after the PRF. Usually we use ultrasound gel, but you can also use a serum. And then I'm going to set it up quite high because Michelle's done this procedure before. And okay, there we go. So there's it on, and you have to keep it moving. You can't like stop moving with this, or else it wouldn't burn the patient, but it creates like a really unpleasant sensation because it's an electric current. And it's really nice if you also have a breakout. So put this off, and then you can actually like shock the little acne lesion. So yeah, that's it. So that's the whole procedure. Thanks for joining me guys today for this PRF video. I hope you enjoyed it. If you loved it, like, share and subscribe. And if you want to see some more exciting stuff and tell me what you want to see, drop it in the comments. Thanks so much.